Medicine versus physiotherapy. Which one is better? Both transform lives, but in very different ways. So in this video, we're going to compare the two careers and look at everything from the point of view of training, earnings, lifestyle, and fulfillment, and various other things that are going to help you make a decision as to which career you might want to go for. So as you'll have probably heard me say in various other videos where I'm comparing medicine to other careers, it is a long training pathway. 5 to 6 years at least to get through university, then at least 2 years of foundation training, then depending on the specialty, at least 3 years thereafter, all the way up to another 8 years or so. So it can be very long. People don't reach the top, whether that's a hospital consultant, usually until their 30s and often mid-30s. Physiotherapy, on the other hand, is much shorter until you can start earning. So it's a 3-year degree, or if you already have a science background, it's a 2-year master's. And then once you have your HCPC, your Health and Care Professions Council registration, you can start working and earning straight away. Physiotherapy has a wide variety of things that people can do with a multitude of areas for progression as well. So within the physiotherapy, they might do neurological rehab, so people who say you've had a stroke and are trying to get back to functionality. It can be pediatrics or even sports medicine, and I know plenty of physios who work with elite athletes and Olympian level athletes as well. Some physiotherapists I know have gone on to become advanced practitioners, and they can diagnose and treat patients and prescribe the same way that a physician associate might be able to, for example. When it comes to roles and responsibilities, whenever I'm comparing medicine to any career, whether it's in acting or anything else, I always kind of put them on a scale of like life-saving to life-enriching. And some are, they're both incredibly important, but they help people improve their lives in different ways. So obviously, medicine, you're more on the life-saving side of things. You're bringing people from the brink or getting them out of really desperate situations where their life is in threat or their health is in serious threat. Whereas, say, an actor is, we're bringing those people back to health to go and enjoy those things, like enjoy the theatre, enjoy the music, and enjoy all of those things that are available to them. So there's the life-saving, the life-enriching. Now I put physio more towards that direction. Now you'll get people, like I say, who work in intensive care as a physio, and say if somebody's having chest difficulties, that is the sort of thing that they'll be called out in the middle of the night to help them. Maybe they've got too many secretions, they need to help them get it off their chest. And that is obviously very impactful from a life-saving point of view. But your bog standard physio will probably end up doing something in the musculoskeletal space, which is people who are impeded in some way by an injury. So they might not be able to exercise, or they might just be in a lot of pain. And really what they're doing there is enriching people's lives. Now, the difference between the way a doctor interacts with the patient and a physio might is that a doctor will usually see them less often in short bursts, make a plan, and then give the plan to the team to go out and enact. Whereas the physiotherapist is usually somebody, maybe they might be part of that plan that the doctor's prescribed, or they might be working independently, but they are much more involved in the actual carrying out of it and seeing the patient as they improve. So they'll end up having a much more personal relationship with that person, because they'll be seeing them regularly as they are taking them through that path to improvement. So that is incredibly rewarding in itself. And when I speak to my physio friends, that's what they say is one of the most rewarding things about the job. So if you're more fascinated by overseeing the care, diagnosing and understanding the complex things that are going on and creating a plan, then medicine's more likely for you. However, if you like that close relationship, you like seeing progress and being part of that journey with a patient, then maybe consider physiotherapy. When it comes to lifestyle and work-life balance, you'll have heard me say many a times that it is a lot of on-call shifts in medicine, working nights, working weekends, missing out on a lot of stuff, exams. It is very fulfilling, but it does come with that sacrifice. Whereas physio, although that can happen, because like I say, if you're working in intensive care and you have to be on call and patients need you in the middle of the night, there are elements where physiotherapists are on call and have to work long hours. But on the whole, your average physiotherapist is probably working closer to a 9 to 5 role. But again, because the career is so varied, if they are working for an elite sports team, or maybe they're working in corporate, it can be a little bit more demanding depending on the environment. Imagine if you're in an Olympic team, it probably requires a lot more intensity and something maybe a lot more similar to the hospital environment. But remember, there is a lot of variety, so it depends on the environment that they're working in. So if it is for an Olympic team or an elite corporate company, there probably will be a lot more demands that maybe mirror some of those put on a doctor in a hospital environment. One of the things when I started working in hospital that I realized about the physios, that when I made friends with them, was that they are a quite tight-knit group and they work similar hours. So I'd noticed that they would kind of all go to lunch at the same time, and they'd have that camaraderie and they'd go out a lot more together. That is a really overlooked thing, the value of having a good group of people that you work with, that you get on with, that you can socialize outside of work with as well, if that's what you like. It happens a lot more easily and naturally in those groups than sometimes with doctors. But although that does happen as well, I felt like that the setup for physios naturally allowed them to have that. And again, the variety and flexibility that physios have does allow them, like we talked about in the pharmacy video here, they can have a lot more of like a portfolio career where they can do a little bit of hospital work, a little bit of private work, they can do other things on the side, maybe some people work for a sports team, and it really helps give a bit of variety, and that kind of enriches what they're doing. So let's talk about the all-important pay. As you've heard me say in other videos, doctors start on £32,000 a year when they are going through their foundation training, doing FY1. And when they get to consultant level in hospital, they're looking at just about hitting the six-figure mark. Physios, on the other hand, start at around 28k a year, and that can go all the way up to 40 to 50,000 pounds, depending on how senior they are or whether they become a specialist. But when you think that you're probably earning about in the region of 3 years earlier as a physio, so that gives plenty of time to build up skills. And what a lot of people do is go and do at least some private practice on the side. They might work, for example, in a musculoskeletal clinic where they're dealing with people's aches and pains and helping them do rehab to improve injuries. And this gives them a lot of earning opportunity that really, it's like any business, the ceiling is almost infinite if you can set up in the right way that suits you. But here is what people maybe fail to understand when it comes to physio, is that they are earning earlier. They're not actually, the gap between the pay and the start is not that significantly different. The work-life balance is better. And because it's better, it allows people to then have the space to go and do those things privately, and then maybe build a business and build up a client base that then can be a lot more lucrative in the future. So if money is the consideration, don't just compare apples to pears, because there are very different outcomes and potentials based on those things. Equally, medicine pay kind of tends to trickle and trickle until you hit consultant, then it skyrockets and there's scope for private practice, but it is a very delayed gratification compared to that of a physio, who can really, as long as they're developing their skills and their know-how and building that patient base, can start having the potential to earn quite a lot quite early. Impact and fulfillment wise, again, it goes back to that very different levels on the scale. One is saving lives, making decisions about impacting patients' care. The other one is improving lives in a way that is kind of slow and steady progress through working with them and building those relationships. So you need to understand, and it's about knowing yourself, which kind of side of the coin do you want to be on, and which thing do you think will drive you more. So which one do you think is more appealing? Which other factors have I not considered, or things that you need to know that are going to help you decide this tough one as to which career you're going to go for? If you pop some questions in the description below, I'll help you answer them and figure it out and get back to as many questions as I can. But if there are more healthcare careers that you're considering that you can't quite decide, check out the rest of the series where I look at all the healthcare professions and compare them to medicine or to each other. And if you want some help with specifically getting into your chosen medical school, you can check out the FutureDoc program, which has an incredibly high success rate, because we help you the whole way and provide incredible support to help you build the best application that you can. So thanks for watching, and I'll see you over in one of those videos.